First of all, let's look at all of your options when it comes to getting health insurance. How can you get health insurance? Well, first, if you're employed, your employer may offer one or more plans for you to choose from. Some employers provide healthcare plans for their retired employees in lieu of Medicare. Second, you can choose to purchase your own medical insurance plan through the Affordable Care Act on the Marketplace website, healthcare.gov. Third, if you are 65 or older or have been disabled, you may actually qualify for Medicare. And last but not least, low-income individuals and special populations may qualify for government programs such as Medicaid or CHIPS. Did you know you can only enroll or change your insurance plan during a special enrollment period called open enrollment? Open enrollment is only offered once a year in the fall. If you miss the open enrollment window, you will only be able to enroll or make changes in your insurance if you have a qualifying life event. So what are qualifying life events? Well, first of all, if you start a job that offers health insurance, that's a qualifying life event. If you happen to lose your insurance, for example, you leave your job or your employer no longer provides insurance coverage. Perhaps you no longer are covered by a parent's or a spouse's plan. Or maybe you had Medicaid and CHIPS and no longer qualify. Another qualifying life event would be if you have a change in your family household. For example, if you get married or divorced, death of a spouse, or birth or adoption of a new child. Another qualifying event would be moving to a different zip code or a different country. And finally, if your income changes or you turn 65, you may now qualify for a government program or Medicare. Open enrollment dates vary depending on where you get your health insurance. The dates for 2024-2025 are listed here. Medicare open enrollment usually begins and ends earlier than the ACA marketplace, so it's important to make your selections before that deadline. Employer dates vary. Most enrollment periods are in the fall and may be much shorter, giving you less time to make that decision. Before you can choose the right insurance plan, there's a few things you must know in order to understand your options. All insurance plans share some common terms that are important to consider when choosing your plan. So let's talk about some terms you need to know. Insurance companies contract with specific providers to provide health services to the enrolled members. These providers are their in-network providers. Providers can include doctors, clinics, hospitals, labs, imaging centers, pharmacies, equipment companies, therapy places, rehabs, even nursing homes. Any providers who are not included in this provider list are considered out-of-network. Depending on the plan you choose, you may be required to use only in-network providers. Some types of plans allow you to see out-of-network providers, but usually at a higher cost. Before choosing a plan, you should make sure that your current providers are in your network. You've probably heard the terms HMO and PPO before. These are types of plans offered by insurance companies, and the coverage will vary greatly. However, there are a few basic things that these plans have in common. An HMO, or Health Maintenance Organization, is usually the most restrictive type of plan you can choose. It is also usually less expensive, but it has so many more restrictions it's almost not worth the cost. All HMOs require you to have a signed in-network PCP. This primary care provider will manage all of your referrals. You are not allowed to self-refer without your PCP making that referral for you. Referrals can only be made to other in-network providers and must be pre-approved by the insurance. This process is called prior authorization. Requesting a prior authorization does not guarantee approval by the insurance company, who has the option to deny the request if they feel it is not medically necessary. Most HMOs do not allow for out-of-network services and do not provide coverage. Pharmacy benefits may also be just as restricted. PPOs, or Preferred Provider Organizations, may be a bit more expensive, but are usually considered the least restrictive. You are not required to have an assigned PCP, and you can self-refer to any in-network provider. Out-of-network coverage is provided, but may have a higher cost or copay. Some services still require prior authorization, but referrals to specialists do not. There are some hybrid plans that fall in between an HMO and a PPO. An exclusive provider organization or an EPO is similar to a PPO but does not cover out-of-network providers. A point of service plan or a POS is similar to an HMO. You still get to choose a PCP and get referrals to in-network providers, but you have the option to see out-of-network providers at a higher cost. In choosing between an HMO or a PPO, it is important to consider a few things that may be very important to you in your healthcare. Is your current provider in-network, or would you be okay changing doctors or a specialist if needed? Do you tend to make your own appointments? HMOs require prior authorization before a referral is made. You may find yourself at a specialist's office for your appointment only to be turned away if your PCP did not make that referral and get the required authorization before that visit. Prior authorizations are not a guarantee for services since they can potentially be denied by an HMO as not medically necessary. When finding an in-network provider, do not ask if they accept your insurance. Many out-of-network providers accept the insurance but are not considered to be in-network. Now that you know a bit about the type of insurance plans offered, let's look at terms related to what it's going to cost you. Your premium is the amount you pay to your insurance plan each month, whether it's through your job or through the marketplace. On the marketplace, your premium may be offset by a government subsidy depending on your income. Your deductible is the amount you have to pay yourself before your insurance plan begins to pay for any services. This amount will be listed either by individual or per family. Some services, such as your preventative care visits, may be exempt from these and covered automatically. Out-of-pocket is the amount you pay in deductibles, co-pays, and co-insurance, but does not include your monthly premium. Your out-of-pocket max is the most you will pay for any health services under your plan in any given year. Once you reach this amount, the insurance company would pay 100% of all covered services until your next calendar year. Allowed amount is a negotiated price for the services that are provided by in-network providers. Your cost, copay, or coinsurance should not be higher than this negotiated amount. However, if you see an out-of-network provider, they are allowed to charge you the difference between their service costs and the negotiated amount, making you responsible for the full amount of payment. Cost sharing refers to the amount you pay towards your medical service. This includes your deductible, copays, and coinsurance. A copay is a fixed fee you pay every time you visit your doctor. Copays for specialists are usually a little bit higher. Coinsurance is a percentage of the allowed amount that you are responsible for at each service. If you have not yet met your deductible, you may still be responsible for the full amount of your service until that is met. So now let's look at the marketplace plans. The marketplace uses a tiered system to classify their plans. The categories are based on the cost of the monthly premium, the amount of the deductible, the amount of copay or coinsurance, and the cost of prescription medications. These are grouped and divided into metal tiers, including bronze, silver, gold, and platinum. Bronze tier plans are usually going to have the lowest monthly premiums. However, your deductible amounts are going to be the highest of all plans, often over $7,000. You will also probably have higher copays and larger coinsurance amounts, and some plans do not begin to cover any services until you meet that very high deductible. Additionally, a lot of these restrictions also apply to pharmacy and medication costs. Bronze plans are probably best for people who are generally pretty healthy and don't utilize a lot of healthcare services, or for anyone who just wants to have a just-in-case emergency plan. Silver tier plans have premiums that are slightly higher than the bronze plans, and deductibles are more moderate. The average deductible is about $2,000 to $6,000. Copays and coinsurance are usually kind of high, with specialist visits being most affected. Office visits, labs, and other services may not be covered until that deductible is met, but the deductible is now lower and easier to meet. Silver plans may also have better prescription coverage, but the copays and coinsurances might still apply. Silver plans are a good choice for most people who may see specialists every once in a while. Maybe they have a few medical conditions that require frequent follow-ups and take medications on a regular basis, but really don't want to spend too much money on the premiums themselves. Now, gold tier plans have the highest monthly premiums, but often have very low or no deductibles. Copays and coinsurance amounts are pretty low, and the prescription medications are covered at little to no copays. These plans appeal to people who have multiple medical conditions and frequently see their PCP, or have multiple specialists that they need to follow up with. People on brand name medications may also benefit from the lower pharmacy costs. Now, platinum plans are advertised to have the best coverage, but they also have the highest monthly premiums. As of now, no company in Texas offers these plans, but may change once the marketplace opens on November 1st. Now let's talk a little bit about Medicare. Medicare is complicated, and we aren't going to get into all the details. Medicare has a similar open enrollment period as the marketplace, but also has the initial enrollment period upon turning 65. Traditional Medicare is divided into two parts, Part A and Part B. Part A covers inpatient care, such as hospitalizations and nursing home care. Part B covers outpatient care, such as your doctor's visits, imaging services, and labs. Traditional Medicare does not cover annual physicals, dental, vision, or prescriptions. In order to get medication covered, a Part D plan would need to be purchased. During Medicare open enrollment, you can exchange your traditional Medicare plan for a Medicare Advantage plan offered directly by commercial insurers. Medicare Advantage plans often do include prescription drug coverage as well as dental and vision services. The downside of Medicare Advantage plans is that you are restricted to use the in-network providers for the plan you choose. You can find Medicare Advantage plans through the insurance provider website or seek assistance from an insurance broker to help you find the right plan. However, keep in mind some brokers do work for commission, so it's best to look for an independent broker who may be less biased. So hopefully you have learned when you can sign up or change your insurance plan, the type of plans available and their restrictions, common insurance terms regarding your associated costs, the tiers and categories of plans offered on the marketplace, and a little bit about Medicare and Medicare Advantage plans. That is a lot of information. If you still have questions and would like to sit with our billing manager in order to go over some of your options, please give us a call, text us, or send us an email. And we will schedule you for a private session to be able to answer any additional questions. I hope this presentation was helpful and that you feel a little bit more comfortable in selecting a health insurance plan for you and your family. I am Dr. Belinda Jordan, and I wish you health and wellness in the year ahead.